When processing office mail and faxes, what is the most important step to ensure patient confidentiality? And we want to keep in mind this most important step because there might be other choices here that are still important, but we're looking for the most important. So option A says opening all mail immediately upon receipt. And that probably wouldn't really affect patient confidentiality or not if you open them out right away or leave it. I mean, maybe if you're opening it right away and then you're looking at it and you could put it somewhere sooner, but the choice doesn't really specify that. It's just saying just opening immediately upon receipt. That's all they're giving us. So maybe, but there's probably a better choice here. Option B says storing mail in a locked cabinet. And that also is something that maybe we'll consider, because if it's in a locked cabinet, then less likely someone could get to it, and we want to keep patient confidentiality here. But let's check out the other choices. Option C says directing mail and faxes to the appropriate staff member without unnecessary delays. And now here it is discussing about mail and faxes there. So if you're faxing to the appropriate staff member, that means that when you're sending a fax from the office, you're stating exactly who it needs to be going to. So it's not just going to be out in the open for just anyone in the office to see. So we could keep it confidential as best as we can. So the patient information goes to the appropriate party and it's eliminated from being seen by anyone who it shouldn't be seen by. And by avoiding unnecessary delays, that's kind of saying that if you speak to someone in another office and say, okay, I'm going to fax you this now, and you do it right after you say you will, then they're expecting it, they're watching for it, and then they could go and get it from the fax, and less likely of a chance that it will be intercepted by someone else that shouldn't be seeing the patient information. So option C is looking good. Let's just look at option D. Making copies of all received mail and faxes, and that's not necessary, and that wouldn't be helpful for patient confidentiality. So we could definitely eliminate option D. So that leaves us between options A, B, and C, because they all seemed important for ensuring patient confidentiality. However, remember we're looking for which is the most important. And option C really shows what you should be doing, because if you're directing it to the appropriate staff, you're avoiding delays, that really helps to eliminate patient confidentiality. So we can go with that. Option B is an important step, but it's not really the most important step for ensuring patient confidentiality. So we will go with option C here.